Hi. Um, anyway, we're trying again. I'm waiting until, the first or so to leave to get a little bit closer to San Diego, which is, where I'm headed. There's been a little bit of a change of direction, obviously. Um, but, in doing some homework and calling, I actually came across their site on my WordPress blog. And, but Dr. Sabian, I think, has a really good approach. It's, what can we use that's going to work, and let's use whatever we can. And for me, that instills a little more hope. And I asked her about infusions, and she said she doesn't do them. And the reason is that ketamine is a very short-acting drug, and as she put it, it needs to be in your pocket. And I kind of like that idea, I'm sitting here, sorry, looking at this old a spray bottle that I brought with me. God knows why. It's completely empty. I can guarantee you that much. I felt sort of like a drug addict, to be honest. But it was just a couple of drops, and I'm like, okay, this is relief. I can live with that. But there's a supplement that's being used, and I posted the link already. And it's a shame that more people don't check it out. It's 400 milligrams 3 times a day. Take it like any med, I guess. And then there's some sprays and some lozenges, and I wish they had some lidocaine in it because oral surgery did spread this to my face. It's why tonight it's beet red. It changes sometimes when I'm just watching things, and boy does it burn. Inside my mouth, though, the pain is absolutely crushing. I feel like I'm 90. I'm 39. I feel like more like I'm 93. And, that's a bit of a scary feeling. To look at one picture, and then a second one, and then this year it's like, oh my God, what is happening to me? And that sort of, I think, motivated me to say, okay, you know what? If it means that I pack everything I own into two suitcases, put my cat in a carrier, and get on a plane, which was a mistake. I should have taken a train. It flared me up and bad. I've been in really, really intense pain ever since. And right now, I used to be a medical patient in the state of Washington. I kept my permit because I believe in accountability. But I don't have my California license yet, so it's kind of like, I feel like I'm skating on thin ice pain-wise. And the nights are horrible. My feet feel like they're being burned with dry ice. And I wonder how I'm going to get through until the 3rd, when I can at least start this and have a little bit of hope. And I think when my stuff arrived, even though most of it is just the P-Pure and some lozenges and sprays and stuff to keep my mouth moist, and then a vitamin B supplement with biotin, I think, or something. It's all on the website. It's a shame that more people don't see what this has to offer. And I'm not going to get into insurance things because it's such a tough issue. Unfortunately, mine is accepted. And I was a little bit surprised, but please, and I think that it feels like a more holistic approach than going in every 4 months. Pharmacologically, when I looked up the ketamine, it was like, that's kind of short acting. She was right. And I'd rather carry it in my hip pocket and get some relief. Because right now, I feel like, I'm sort of going, okay, here's this great space heater that somebody sent me. And I'm always cold. I'm always cold. And my email address, those of you who have it, there's a clue for you. 80 degrees doesn't even do it. I'm usually wearing layers. But I look at myself and I'm like, what has happened? You know, I spent a year, needing oral surgery, and, in a state that the system is fried. And I think a lot of the providers are too, but I don't think that's any excuse for treating somebody the way I feel I was. And I just want to leave that part behind me, so that's all I'm going to say. Except that poor dietitians recommending enteral support, poor people are not wrong. Now, one of them may have thought I had an eating disorder, but that is one way to get gastroparesis. So is diabetes, and so is surgery, and so is RSD. Anyhow, it was interesting that she's as instinctual as she is. When I talked to her on Dr. Sabian on the phone, I think it was, when she asked me, do you have cold CRPS? I'm like, how did you know? I'm sitting in front of space heaters. Last year I had $250 a month power bills. It was like, ooh, I just paid it. What else do you do? I want to stay warm, thanks. But I would heat one room with a space heater with the wall heater turned on 90 degrees, and I was still cold. And I would sweat right through a change of clothes in a couple of minutes. It's nothing to mess around with. And there were many times that I should have gone to the hospital and I didn't. I have personal reasons for feeling that way. And they're very valid. I trust you. I can guarantee you that. Very valid. And what it makes you as a human being. A psychological response to pain like this is the same thing. I think eventually we all are going to develop PTSD. Or some variant of it. What it makes you, I think, is almost as close to normal as you can get. Because to not react to this level of pain, I would worry. It was like when kids would come into the emergency department with an injury. We worried about the ones that didn't scream and cry. I don't think adults are that much different. But anyway, that's just me. I'm just a very passionate person, and that's just how I am. I'm the type of person that if I see a wrong when I'm working, I'll walk off the job. And I have. I got written up for getting a dying man some pain medication. I said, where do I sign? This is my last shift, and I'm not working here anymore. They put me down as fire, and I went, right, go ahead. But, I loved my job. I want to return to some variant of it, and living like this, I can't do that, can I? So I want to throw what I can at this, because I think medicines work longer that way. Anyway, so it's getting through the next couple of weeks. I'm starting my supplement. I'm committed to making this work, financially and on my end of taking my medication the way I'm supposed to, which I do anyway. And if the question is out there, the answer is no, I'm not using an opiate. She doesn't accept you if you are. And I think they make it worse. I think Dr. Chopra is right. And, when they offered me an intrathecal pump, I'm like, you're going to stick that in that mess of a back of mine. And you're going to put in more drugs that don't work for me. Now, for some people, they are helped by them for a while, I think. Some of the new studies on the ketamine are a little concerning. And I think that's another reason I decided against infusions for now. If things worsen, yeah, I'll do it. I think you got to take care of your body before your mind's going to improve. And sometimes it involves being a little bit selfish. And I think that's why I left behind almost my entire life. But the support of some wonderful people that act like family. And those are the people that I list as family. And I'm very blessed to have them. So thank you for watching this update Sometimes I do better talking, sometimes I do better writing, and so I'm just going to kind of go with what works. But, you know, right now it's March 3rd. I'm going to be staying in Ontario with a friend and taking a train. Thanks to the Bradley Tickets Fund, I will have an unlimited pass to take my train down to San Diego 3 days a week. Hopefully I'll get enough relief that I can go down to Mexico and get some teeth made. It's cheaper down there, you know, and it's a nice trip, and yeah, great weed. Keep the permit though. It's called responsibility, folks.